in, like everybody's coming in. Okay, we'll wait till everybody gets in and connects. Hi, Tara, how are you? Mary Jo.
All right, how are you? Sorry, had a minute's
Good.
trouble unmuting.
That's no problem, Mary Jo. I see you've come in. That's wonderful. People are coming in and starting to unmute, so we'll just give everybody a second to get in. Gina's in, Nick is in. Christiana, which is a beautiful name, is in. We're doing good. People are coming in.
Mr. President LJ, sir, your name has changed.
Is LJ in here with us? What?
Why
I
got
there he is. There he is.
I was wondering how I had Christiana's name.
I was like, that's a beautiful name. It's a beautiful. Hi, sir.
Hey, how are you?
I am very good. Very good. It's good to see you.
Good to be seen.
Well, we're going to go on and start, and I'm gonna give the floor to you for a little while, and just a second to say whatever you would like to say, Mr. President. That'd be great. So, welcome everybody to the Healthy Counties meeting. We're walking into the holidays, and so I know everyone's really very busy. So, the Healthy Counties Advisory Board meeting is, I think, right timely for what we're going to talk about today as we get ready for the holidays and the new year and kind of reflect on the year that has been. But the first thing I'm going to do is recognize the vice chairs, and then I'm going to give some time for the president to speak, and then we'll go on with the agenda. And so in the room with us, I do see already is my friend from Douglas County, Nebraska, Marianne Borgensen. Hey, Marianne. Commissioner Dennis Deere from Cook County, Illinois. Thank you for being here. Natalie Hall from Fulton County, Georgia. I don't know if Natalie's in yet. The County Treasurer, Jennifer Henderson from Schleicher County, Texas. Commissioner Brenda Howerton from Durham County, North Carolina. Chairman Sig Hutchinson from Wake County, North Carolina, where we're going to have our Healthy Counties Advisory meeting next year. We're all very excited about that, and we'll talk about that a little later. Marnie Kyle, who's the Director of Health and Human Services in Washington County, Oregon. Nick Machione, I think your name is super cool, Nick, Director of Health and Human Services in San Diego County, California, where we were not too long ago, Mr. President. Carol Morley, the Public Health Director from the Idaho Central District of Nass, Pierce County, Idaho. Patricia O'Bannon from Tuckahoe District Supervisor from Henrico County, Virginia, which is just right down 95. Kenneth Wilson, the County Administrator from Franklin County, Ohio. And finally, we always want to thank and be very appreciative of our corporate sponsors. Our corporate sponsor today with us is Vice Chair Carol Reynolds from NetSmart. And so we're all in. I want to thank the vice chairs for the meetings we've had with the Executive Board of Healthy Counties, where we just kind of talked about the agenda going forward and what we want to do today. And so thank you all for coming. I also definitely want to thank our Healthy County sponsors, because without you, there's a lot of things we just could not do. So Aetna, United Healthcare, Esri, which we have an Esri office located right in Loudoun County, Virginia. Massimo, who am I missing? Optimum United Healthcare and NetSmart Technologies are all Healthy County Advisory Board members, sponsors. And again, this year, the past 18 months especially, we really, really appreciate you. So before we go on the agenda, I do want to welcome my friend, the Commissioner Larry Johnson, the president of NACo, the man who wants us to thrive, the man who has a good day every day, and the man who made my Deputy Chief of Staff, Danielle, feel so special when you sang happy birthday to her. Thank you. She talked about that ever since she's gotten back, Larry. It was wonderful. So I'm gonna give you the floor to say whatever you'd like to, Mr. President.
Thank you, Madam Chair. I appreciate the time and glad to see you all in the cab. And Danielle, you better be glad I couldn't get the rock out of that back room.
Oh.
I would have had the rock come and say another happy birthday. It had been a viral moment. But I just want to thank you all. See, Mary Jo, we were together in Minnesota, and I just left Ohio, and I just saw Ms. Walsh yesterday. I was in DC working with our Vice President and our U.S. Treasury, Yellen, on another program that they're going to announce for us. So I just want to say thank you. The healthy counties, keep up the good work. My word for you all this holiday season is mindfulness, mindfulness, mindfulness. Make sure you're present where you are. It's so easy to be in 5 different places at one time, but just be present wherever you are and to enjoy the moment. And I hope you all have a great holiday. And I'll see many of you on my call on Thursday with our chairs, President chat with the chairs. And just keep up the work, Madam Leader. And I'll be on as long as I can. I got to run out to a radio interview because I got 500 kids for Christmas that I've adopted. And I got about 20 left. So I got to get them.
Oh, that's amazing. No, I have been following your Twitter page and seeing all that you're doing with in Georgia. And it is absolutely incredible. The work you're doing and with the kids is incredible. So you are just such inspiration. You really do believe in that work thrive. And so appreciate you so much. So members, today I thought we would have just, we're not going to have a speaker today. I talk about this all the time, or I have been speaking about this. This past 18 months has been so unusual for local elected officials. And I was talking to a group the other day in Sorensen, which is a political training institute here in Virginia. And I said that, more often than not, people will speak about federally elected officials, congressmen and US senators, or even about their state elected officials, the delegates, the senators. But during this past year, the past 18 months, COVID, the reckoning and racial justice issues, all those things have been so county centered. Everything from getting testing sites, well, really understanding what COVID was, getting testing sites up, figuring out where and how to get PPE in, doing vaccination clinics, and all that came with it, all the education, all of it has been a local government response. For God's sakes, figuring out CARES Act money and ARPA money and how to get that in the door and then back out the door, do it in a way that was timely, do it in a way that was equitable. All those things have been a local government response. And what I realized a couple of 2 months ago was that I was getting kind of more 2 things, more tired and more short with people, which is, those 2 things are really unusual for me. I'm like, I can go forever and not really feel too tired. And I don't really get short with people very often, but I felt that happening to me. And I had to kind of stop and say, you know what? I hadn't taken care of my own wellness, my own mental health, and maybe not even my own physical health, and that I wasn't really getting the rest I needed to get. And so I wanted us to have a conversation of local elected leaders about our own mental health during COVID, what this has meant to us, and maybe more importantly, what should we be doing to take care of ourselves? Because we really cannot take care of our constituents if we don't take care of ourselves. We just can't. I mean, we're human beings. And so I wanted to have a discussion about what you guys experienced this past 18 months, how you dealt with it, and what you're doing going forward. And I will kick it off myself by saying that I was in my office one day, and I got a phone call from a woman, and she said, Chair Randall, the residents over at is one of our senior care facilities, facility X, she said, they're not eating. And I said, what do you mean they're not eating? They're like, what do you, I don't know what you mean. And she said the entire food service staff got sick with COVID and went down. And I was like, okay. And I said, when did this happen? And she said, Friday. It was Monday. And so I said, so over the weekend? And she said, they haven't been eating. So I got up, walked down the hall, talked to the county administrator, talked to our absolutely amazing county staff. And we figured out how to get food over there. We called the hospital and asked for a hospital, some of the nurses' aid, how to get help over there. We figured it out. We figured it out in a couple of hours. We got them food, we got them fed. At the exact same time that I am trying to figure out how to get that done, there's a protest outside of my office, right outside my window, of people who were claiming COVID wasn't real and who were literally blaming me for COVID. And they had signs up calling COVID the Randall scandal. And they had signs with me with like little devil horns and little Hitler mustaches. And I thought, this is such a disjointed moment where I am trying to find out how to feed seniors while still having a protest going out outside my office. Now, normally, as elected officials, if we have somebody protesting us or saying negative things about us, that rolls off our back. We try to listen to the issue, but we're not really going to be taken down by people who have signs with us with, devil horns, because really, I mean, what are you, fourth grade? But for that moment, I was so upset by the protesters. And it took me a while to kind of work through. It wasn't that they were protesting me or Randall scandal signs. It's that they were somewhere in my head, they were disregarding the human suffering that was taking place in Arbery County. And that was very, very upsetting to me. I also found somewhere right around, I don't know, I guess like June or July of 20, I would get really anxious right around 11 o'clock in the day. And I realized why. And it was because in Virginia, our COVID numbers dropped at 11:30. So what happened the night before came in at 11:30. How many hospitalizations, how many new cases, how many deaths in our county, that dropped at 11:30. So I would kind of be holding my breath and being really anxious while we're waiting to see, who died. As elected officials, we know we're going to raise taxes, and we're going to lower taxes, and we're going to build roads, and we're going to have people yell at us about the roads we build or the taxes we lowered. We're going to have all that happen. But we don't normally spend time doing a body count for our own people in our county. We just don't do that. That's just not where our heads are. And that's not why we just don't think like that. And so I realized right about then that I really had to start kind of doing some guided imagery, some meditation, some self-talk, some reflective listening, some using some of the apps to just get me through some time, because it was a very, very hard year for us. And so I just thought I would kind of take a moment and open this up to ask people, how was your year? And what did you do to take care of yourself? And what will you do? What lessons did we learn going forward? Because if we are going to take care of other people, and that's what we do, we are servants. We are citizen servants, but we cannot do that if we don't have the wellness that Commissioner Johnson talked about. If we're not being reflective, if we're not taking care of ourselves, we just can't have it. And when we think about what we're going to face in the next 2 to 5 years, what I'm calling the second pandemic of mental health and substance abuse and trauma and suicidology, that's all coming down the pike. That's, as a result of COVID, that's all coming. And so if we're going to be healthy elected officials, healthy human beings who can take care of ourselves and our families, we got to do that first. And so I wanted to stop, and this is the right committee to have a conversation about mental health and wellness and all those things, and to give ideas and to be one another's village and support system of how we're going to do that going forward. So I'm going to stop talking, and I can see most of you on my grid. Let me do a different gallery so I can see all of you now. That's better. And you can put your hand up in chat, or just put your take off your mute button and start talking. But let's take care of today. Let's stop taking care of everybody else and just take care of one another and ourselves right now.
I'll go next.
Brenda, thank you.
So thank you for what you just said. It just touched me. This year, we have had so many shootings on top of the COVID. We've had so many shootings, so many murders for my teenagers. And it has been so overwhelming that we've had so many from the age of 3 to 18. So one of the things that we have been asked to do out of a court case for a 13-year-old was in our adult jail and died in that jail. So the court ordered that we build a new jail that we do not ever put underage young people in an adult jail.
Absolutely.
So we started on that quest to do that in 2015. So we've had 22 public hearings to get this facility up and have it be a therapeutic center, so that you've got an assessment center, so you've got the mental health. So because young people that kill people need mental health. We can't put them back on the street. So we've got an advocacy group here in the community that has been screaming at me, because I'm the chair, that we need to just put the electronic monitoring bracelet on them and just put them back in the street. And I think something wrong with anybody that thinks that if you murder somebody, that there's no accountability here. So we are going forward with the facility, and they have been sending me nasty emails, all the things that we get sometimes. And I said, what about the victims? What about the victims that have had to bury their children and their loved ones? There's no compassion for that. So when a young person kills someone, you lose two people.
Yeah. You
lose the person that has been murdered, and then the person that has committed the crime. That person's life is hopefully can be rehabilitated at some point. But you've got to put them somewhere so that can happen.
Yeah.
Well, going through all that, I was really having a hard time. So I went out and bought me a Peloton. I said, I've got to get some of this stress out of my body, because it was really weighing on me heavily. When you hear mothers, and I'm sure all of you have heard mothers crying about their children that have been killed, and they don't think that we care.
Yeah. Yeah.
That's a hard one.
Yeah.
So I said, I got to do something here, or I'm going to lose it. So I went and got me a Peloton. So 5 o'clock in the morning, I'm on my Peloton, and I do it for an hour to get rid of some of the stress. Because
has it worked?
It has.
Good.
Yeah, they call me up, I deal with it.
Yeah. Yeah.
It's a good stress release, because
right.
Peloton, the bike pushes you.
Yeah.
Really hard.
Yeah.
So that's my stress release right now.
Thank you. That was very helpful. Thank you so much, Brenda. Kenneth, you had your hand up.
No, I was applauding.
Oh, that was applauding. That was applauding the Peloton moment. Yeah. Amen. Amen. Yeah. Yeah, absolutely.
Thank you.
Thank you. Thank you, Brenda. Anybody else want to talk about what your year has been like and how you've found your coping mechanisms?
I would be happy to talk.
Okay, Gina.
Hi, everyone. I'm new to being on the county board. So this past year has been quite stressful, just being on the board and raising taxes and finding homes for the homeless and feeding the hungry and dealing with the deaths of COVID and everything that comes onto the county board. And I think with COVID, I realized after a year, I used to walk in the forest preserves and with my camera, and I stopped doing that. So I grabbed my camera again and I started walking and taking photos of nature. And I found that to be so helpful. And then posting my photos, which helps other people.
Yeah.
Yeah, so that's my mechanism. And I do love that Peloton idea because that's probably the next step. So thank you.
So this was your first year on as an elected official was the COVID year?
Yes.
Oh,
Yeah,
wow. Wow.
Yeah.
It's not always like this.
Right.
It's not always like this. If that helps.
So I was on the school board, left the school board as COVID was beginning in March. And then November was elected as a county board member. So yeah, it's been quite a year, but I'm enjoying it. I'm enjoying, helping people, learning how to cope with things. And it's been a good experience so far.
Well, I love your coping mechanism, but I also love that that what you just said was, I love helping people. So even though we know this has been a hard year, this has been a tough time, even through all that, we are helping people, right? We are, whether they know it or not, sometimes we are helping people. So I love that you still recognize that. So that's very healthy.
Thank you.
Anybody else want to talk about what this has been? Mary Jo.
Oh, thank you. Thank you, Madam Chair, for hosting this discussion. I think it really is a healthy discussion and a great opportunity for those of us in healthy counties to have it. I, first of all, want to give a shout out to our president, Larry Johnson, who came and, as he said, visited our annual meeting in Minnesota. We had such a great time, and just to be there with Commissioner Johnson, his great positive attitude. I think our whole convention was just excited to have you there, Larry. So thank you so much for the energy and the positiveness that you brought to us. And I think that's my message, as we have all been dealing with such, we've been struggling with, the pain in our communities, the food insecurity, the homelessness, the violence and I'm Mary Jo McGuire from Minnesota, St. Paul, Ramsey County. We have had our share of a lot of that going on. And so we're trying to maintain a positive attitude, and to do that, we're all trying to take care of ourselves. I'll just add what I'm personally trying to do is, keep up my exercise. And I love the Peloton idea. I try to get out walking, snowshoeing now. I'm so excited. It snowed here, so we love the snow. Snowed when Larry was here. We love that. And then I'm trying to get to bed earlier so I can get my sleep. And then I'm trying to eat well. So the eat, sleep, and exercise, I'm just really giving myself permission to take time for all of those things. Because, when you get so busy, you do take care of everyone else besides yourself, and you don't make time for this. So I'm not going to feel guilty about it. I put it on my calendar. I say MJMNA on my calendar when I need to work out. And then nobody can schedule anything on top of it. And so I just think it's crucial that we do all, put our mask on first, as we know is so important to do.
Yeah.
So thanks for having this discussion, and for, really, I think we can all help each other and affirm the, this permission to really take time for ourselves. So thank you, Madam Chair.
Mary Jo, I think that's such a powerful statement. Permission to take care of ourselves, right? Because that's literally what it is. We have to give ourselves permission to take care of ourselves, and we don't always do that. And sometimes, as you said, and my dep chief is on this call, is literally scheduling stuff that takes care of us, right? Like she started putting on my schedule, like, go eat, which sounds ridiculous, but sometimes I don't go eat.
Absolutely.
Right? So
no, it's true. It's true.
Right. It is true. So yeah, no, I love that. I love permission to take care of ourselves. So thank you. Tara, is your hand up, Tara?
Yes, thank you, Madam Chair. I agree with the take care of yourself. And because I haven't heard it yet, one thing that I think is really important is not enough of us take advantage of professional assistance. like therapy, therapists when we need it. Secondary trauma is a really big thing. And I've seen it in a lot of electeds, even if they haven't admitted it yet, between public health concerns and violence concerns and economic concerns. It's a really, really big deal. And I think I'm probably fortunate in that I have several kids. I'm a single parent, which is why I'm in my car at car pickup while on this meeting, multitasking. But one of the things when I was talking with them through this, they kept talking about how it was important for my kids to show their feelings. And I realized that I felt better. It's not okay to yell at people all the time, but if I let my constituents know, like, really how this was impacting the government and their public health workers, that made an impact. And I think made some people think about what they were doing. And even if we didn't agree, like maybe how they were dealing with us, which I don't know about you, but the all caps emails in my inbox are a little stressful. So reducing those is very nice. But I think, between making sure that we're taking care of ourselves with, we don't want to put that extra pressure on our friends and our family, but we also have to be able to get out. When you get a phone call from someone saying, I'm going to lose my house, what do I do? Or, where do I go? It's a lot of stress. It's a lot of pressure. And I saw, Brenda, I saw on your face when you were talking about the challenges of our community, that doesn't go away. We don't brush that off at the end of the day. So making sure that we have a place to turn around, that's been really important for me. And then just, I've said straight out, like, this is stressful and this is hard. And you yelling at me is not going to change my decision because I think it's the best one. So let's talk about it like grownups, or I don't know.
Yeah.
But that at least, I don't know, maybe they're yelling somewhere else, but it lowered the stress in my inbox. So
yeah, I like that. So you've said that to your constituents, like this is you said to your constituents, you're like, you're yelling at me, and that's not going to change anything. But let's try to talk about this differently. You've actually said that out loud.
Yeah,
That's
and
cool.
not as much about me directly, but like my public health staff was leaving because they were getting threats on their life. And no, if you don't agree with it, say you don't agree. We can go on. Like, they'll mark you do not agree and carry on. We can spend our time on something else.
Right.
But that's not a way, it's not going to change. If you have COVID, you're going to have to isolate. If you have to be quarantined, you have to quarantine. Calling them names and sending death threats and things isn't going to change it. And we have changed our policies based on what we were hearing from families. We've implemented a test to stay program because we were hearing from so many parents saying, I'm about to lose my job because my kid keeps having to quarantine. And we said, all right, that's a legitimate concern. Let's work on how to fix that. So we figured out a way to fix it. But if all you're doing is screaming, saying this isn't real, it doesn't work. And so,
Right. Well, Terry,
I think sometimes, like, if you have a toddler that's yelling at you, you just yell back really quick and they stop and then you can talk.
And you can talk to, Terry, something you said that, I don't think people really do realize is what secondary trauma is. And I said this to someone, in our country, we've lost 800,000 people, 800,000 people. That you can't have a nation lose that amount of people in 18 months without having a nationwide trauma, secondary trauma. And we experienced this after Pearl Harbor. We experienced this after 9/11. We experienced this all the time, but we never talk about it. We never talk about what secondary trauma is, because if it doesn't happen to us right now, we think we're okay. But we see it, we feel it, we know it. It's almost touchable. It's in the air. So, and the idea of getting professional help, Terry, you're completely right. Go talk to somebody.
We prepare for immediate one-time events.
Yeah.
But we don't prepare for long-lasting day after day, like was talked about earlier, like seeing the reports come in. We don't prepare for that.
No, we don't. But I like the idea of just saying how you feel. Just saying it. I love that. That's great self-care. Herb, you have your hand up. Herb Richards, you have your hand up, sir.
Yeah, thank you. Very interesting conversation. And I have to agree, we do plan for events that happened in the past. Something similar that happened in our county was the the lava episode where it just kept going on for literally a year and a half. And so it was that constant tension all the time. We lost, I think it worked out to be about 750 houses. And you could hear it in the background, and the stress level throughout the community was non-ending. It just, there was always that constant pressure. So it's interesting because our county has gone through so much, and this was just one more thing. So I appreciate all the comments that have been made. I tell you, it's that level of stress and what the community has tried to endure, and you keep trying to recover, but you don't even know if your house is going to be taken down lava field and all that. So I really appreciate this conversation. It's very helpful for me. So thank you.
And so Herb, what have you done? Because I mean, that is it's such a unique issue, right? I mean, lava, for God's sake. I mean, that's such a unique issue. And you just have no control over that. It's literally out of your control. So what do you do to try to take care of yourself? Because you can't take care of the lava, right? So what do you do?
No. Well, and so there's a lot of community meeting and funding. And just for the record, I go by Tim, and I think I've met some of the commissioners and council members out there. So that's the nickname that I go by, but thank you. It's trying to plan for the future. And that was probably and getting finances as quickly as we can into the hands that were needed. Small businesses going out of business, housing that's no longer available, families that are broken up because they have to move because the house literally is gone. We had to deal with the whole animal side, had to evacuate, I think it was about 1,000 cattle, dogs, cats, goats, all that. We ran into problems where lava ended up, this was a hard one. It took some of the animals because they couldn't get them out of the way fast enough. So from a support thing, as a legislator for our county, what we ended up doing was trying to get the funding there as quickly as we can, and then try and start planning for the future and to give hope, because I don't see really there's any other way there. I went down, and my other vocation, I'm a veterinarian, so I went into the shelters. One thing we did as a county, we opened up the shelters to be pet friendly, and under the Red Cross, they don't like that. But I give our mayor, the way our function is, our island is the county, and we have one mayor and we have 9 council members. And our mayor at that time said, no, we're going to open this up and make it pet friendly, which was a big deal because people, what are you supposed to do with your pets? And so they were we did open that up. And as a veterinarian, I was going to the shelters a couple of times a week just to make sure we had animal health being cared for, but also human health, because there's a few things zoonotic, meaning could cross over, that we're just keeping an eye on. But also people just wanted to talk. They just wanted to talk. And so we did that. And like I said, that went on for about 10 months or so. And kind of a funny story, funny now, but we went back and started putting in some roads once the lava had stopped flowing for about a year. And we're talking a lava flow that's like 50 feet tall. We're not talking a foot on the ground. We're talking massive. And when we started running the dozers, literally the temperatures of the rock once we start cutting through was 800 degrees, 900 degrees. So the dozers, the steel was actually starting to melt, and we couldn't put down blacktop. And again, levels of stress because we can't get back to any normalcy. So striving for normalcy, trying to get through this. And we had hurricanes, we had flooding, we had a bunch of that stuff. Then we go into the pandemic. And our poor little county has had a rough run, real rough run.
Yeah, is it ever, Tim, that you just kind of say, okay, so for right now, we're not going to be normal? Do you ever just say that, like, we're just not going to be normal right now?
Well, I tell people, I said, look, I'm from agriculture. I'm also a cattle rancher. And I said, and anybody from agriculture, you are inherently optimistic because you have to be. And so, and we're a rural district. We have a lot of agriculture on our island. So, just kind of put your head down and keep going. But from the government standpoint, I think the biggest thing is to try and be working towards the future rather than focusing on the present, because I don't see any other way at a policy level we can do that. So we got to be focusing on our future.
Yeah, I understand. Wow, Tara, I agree. The focus on the future. Tara put a thumbs up. I agree with that completely. Thank you. Wow, lava. Just when you think you've dealt with everything, Tim is dealing with lava. that just does not.
It was funny because we were dealing with FEMA and they said, well, you have to have this road finish construction by 18 months after the initial episode. And I said, well, where's the portion in the FEMA handbook about lava?
Exactly.
So apparently we helped write that new chapter. So.
Right. Yeah. Thank you, Tim. Wow. I you know what, when some of my colleagues start talking about and complaining, I'm like, listen, you're fine. There's not lava running through your streets. You're fine. We're going to be just fine. That's my new saying. We don't have lava. That's what we're going to say from now on. Thanks, Tim. I appreciate you.
No, thank you guys. Great call. Thank you.
Anybody else want to say anything else? So these are the takeaways that I've heard. Brenda had to leave, but she said Peloton, but what she's really saying is exercise, right? Do something to exercise, to get out and move. And Brenda, yeah, she's still there. I think you're right. Gina is taking pictures, walking trails, taking pictures, which makes her happy, but then sharing those pictures with other people, which are making them happy as well. Tara is just flat out saying what she needs. Like Tara's just like, listen, you can yell at me if you want to, but it's not going to help. And we're going to do anyway. So how about we stop yelling and be adults and kind of get it together, right? So that's amazing. Tim has figured out that helping people helps him, even as he's working, helping people helps him. So those are all really good things. And also Tara said, get professional help if needed. That's also very, very powerful. Get professional help if needed. And there's nothing, absolutely. That's literally what I do for a living, right? Get professional help if you need it. Me neither, Tara. I've never been called shy either. None of us, we're elected officials, we're probably not shy people, right? So get professional help as needed. This right here, like talking to people, and one reason I love NACo so much, I love NACo. But one reason I love NACo so much is because you don't always find communities who actually can understand what you're going through. You go talk to, Marianne can go talk to her sister-in-law about like her stressful day, but her sister-in-law is not a local elected official. So it's different when you talk to people who are literally doing what you're doing. So this what we're doing right here is also what we should do more of. Like find people who are in the same storm with you, and they figured out how to get an umbrella or a boat or something to help them get out that storm for that moment. That's really what we should do as well. So anybody else before we kind of?
Madam Chair.
Hey, Marianne.
Hi, everyone. I think one of the things, besides de-stressing ourselves and thinking and taking care of ourselves, we also have to celebrate. And I was reminded of this morning during a conversation of our small accomplishments. I happened to be talking to one of our court administrators about our mental health issues with our juveniles and our adults. And as we were talking, I started to talk about some of the things I'm proud of that we've started here in terms of programming. And when I got done, he said, I understand you're upset that you haven't, quote, fixed everything. He said, but look at what you did for that one person that you just told me about. He said, so to me, you've done a great job. And that really helped, because sometimes I think we get overwhelmed. And Brenda, I mean, the outbreak in youth violence that we have here, I'm just distraught over. I mean, they're younger and younger and more violent and more violent. But again, if we remember the little things or the big things that are not as massive in numbers, but massive in success, if we remember those, that does seem to help not only our hearts, but our minds.
Oh, I love that. I love that. And I think that's good. We never remember what we're doing well sometimes. Yeah, yeah. I also do, about once a week, there's a poem that I read, Marianne. It's called The Man in the Arena by Teddy Roosevelt. I always go, if you haven't read that, go Google that poem, The Man in the Arena, because it really talks about the fact that, not everyone's like in the field trying. Some people are actually from the outside throwing rocks on purpose, but to be in the arena is a victory in and of itself. So we celebrate the little things or the big things, but being in the arena and trying, even if it doesn't work out that day, being in the arena trying is a victory. So yeah.
Nice.
I haven't called on anybody, but I might call on Cheryl, because Cheryl, you are the most multitasking person up there. You're like listening and doing some papers and working and listening. You okay up there?
Yeah, and that's how I stay sane. I'm just like a workaholic, constantly moving, constantly can't sit still.
Okay, all right, good. But you're doing okay?
I like to think so. Most of the time I think I'm losing it, but that's how I stay sane.
Okay. All right, well, if it works for you.
Yeah.
All right. And
Yeah.
Ken, if you have anything before we hang up, you good?
Commissioner Randall, I've been holding on to gratitude, trying to put a focus on during, with so much going on, so many responsibilities, just focusing around things to be grateful for, and trying to turn my energies towards an appreciation for where we're at now versus all of the losses we face.
Yeah.
I need more exercise. I know that as a way of dealing with stress. So I'm glad that there was emphasis on that today. But I've been trying to place my continued focus on gratitude, particularly as we go through these weeks towards 2022.
Yeah.
Try to
Yeah,
give
that's
me
good.
a boost in energy for the work ahead.
Yeah. I agree with that. Thank you. I agree with that. Yep. Anybody else?
I can share. I can't share my video right now, but this is Lynn Canfield in Champaign County, Illinois.
Hey, Lynn.
Great conversation. I never have a problem with exercising too much. I actually have to try to exercise a little less. Sometimes it's, a substitute addiction. So you know how that works. But the thing that's been really great for me is like really being conscious of my mindset and listening to people, because it turns out that the people around me are constantly telling me the things I need to hear, even if I don't like it. It's been a mindset shift. Anyway, that's all. Thank you so much.
Well, I like that. And one of the reasons I really, he can't hear me right now, but one of the reasons I really appreciate my my chief of staff is because there are times he'll walk in and he'll say, "Now you hired me to tell you what you need to know," and he'll tell me something that I may not want to hear, but he's often right. And so I just kind of like and take it in. So yeah, and so when you have people around you who care about you, even if you don't want to hear it at the time, if that person's coming from a good place, it really helps to hear them. So I agree. Hey, Deanne.
Hi, thank you so much for welcoming me to this this little get together. Oh my goodness. Just getting the chance to listen to other people's stories and hear how they have navigated the difficult days, and is very inspiring, and that certainly helps me to cope day to day. I mean, the eat right, exercise, obviously, because I just came in from, it was a 4.6 mile day today, just because it was warm and sunny. It's like, get her in. But just basic self-care, and then smile at people and they smile back, and oh, doesn't that help?
Yeah.
It helps so
Yeah.
much.
Yeah.
So being here with all of these smiling faces and hearing stories of strength and hope and continued perseverance has inspired me today and made my day better. Thank you, one and all.
Thank you. That's wonderful. Thank you. That's great. That's wonderful. Well, I will say, I agree, Gina, kindness is everything. And sometimes it's really amazing. Sometimes even people are yelling at you, if you smile at them or comment at them a different way, it does catch people off guard. I've had people like send me this really angry email, the all caps email. And then I will call them, right? And it just freaks them out. It's like, hi, so-and-so, this is Phyllis Randall, chair of the county. I thought I'd call you about your email. And they just, it's just the temperature goes. They're never as angry on the phone as they are in their email. Not ever, right? It's a big difference. So, well, this was wonderful. And I've heard a lot of very good advice. And I think we should do this. I think every once in a while I should just call Marianne and go, Marianne, this is what I'm stressed about today. Talk to me. Mary Jo, this is who yelled at me today. I'm gonna talk to you. I think we have to be one another's support system, because again, we are an arena that's really unique. Not just local officials, but not just elected officials, but local officials. There is a difference, and it's been really clear this year. So thank you all for joining us for this great conversation. I have a few announcements. If no one else has anything, I have a few announcements. This has been fantastic and helpful. So for our next full Healthy Counties meeting, we're going to do that in person at the Legislative Conference it's February 12th through 16th in Washington, D.C. Our business meeting will be on the Sunday. So on February 13th will be our business meeting. And then we'll meet again for lunch later that day. We will join the Healthy Counties Arts and Culture Commission on a discussion about healing through the arts, which is really big. That's really important, because when we think of the arts, we think of like a picture, but the arts are music and dance and sculpture and all type of things. And I always think I have no artistic ability whatsoever, but I love music, and music for me is very healing, and the music is an art. So I can't play it, but listening to music is very healing. No, Natasha, you're smiling. I have no artistic ability, none. But I love the arts and watching it, and it is very healing. So we're going to have that. So if you haven't registered for the NACo conference yet, be sure to do that. The legislative conference is I think, Marianne, it's the most, and Marianne and Mary Jo, it's the most attended NACo event there is, isn't it? The Ledge conference, even more than the annual conference. Is that not correct?
Well, I think we get more at the annual, though.
You
There's
get
more
more at the
people that
annual?
attend, but it's a well-attended conference for sure.
Well-attended
But I
event,
think we
yeah.
do get more at the annual.
Okay,
I'm
all right.
guessing. Marianne, would you say that's true?
Yeah, but it is one of the most attended.
Yeah.
Okay.
I mean,
Well,
the two of them are the biggest, right?
The two big ones, and it's also fun, and and if it's decent weather in DC is pretty cool to kind of like toot around in the middle of the winter. So please do that. If you haven't registered, you can go to NACo.org to register. Remember to send your updates on your county initiatives to Nastasia or the NACo staff liaisons. We can highlight you in our Healthy Counties monthly newsletter. Remember to plan for SIG's not on today, but plan for the Healthy Counties Forum, which will take place April 6th through 8th in Wake County, Raleigh, North Carolina. We've been trying to get the Healthy Counties Forum back, and SIG has been trying to get us to North Carolina. I'm really excited. I'm excited it's going to take place in April. Here in North Carolina in April, it's beautiful. So we're going to have opportunity to talk to experts, connect to one another, figure out how we can continue to help our residents by helping ourselves, talk about COVID. And before we close, we're going to close about, I think we'll give you back 9 minutes today. I just want to thank everybody. Nastasia, thank you so much for all you do. Sincerely, the NACo staff, give them a round, everybody. The NACo staff is just fantastic. You all, I said to Matt, he's hired the nicest people, like just the nicest people work in NACo. And he said to me, and they better be nice or they won't stay there anymore. but you really are just the nicest people. So thank you very much. I want to thank my DEP chief of staff who does all of my regional bodies, Danielle. Danielle, wave your hand. Danielle is wonderful and very, very helpful. And she's the one who makes me eat. That's her. She's the one who makes me eat. So thank you all for coming. Please stay safe. Please stay engaged. Please let's keep talking about all these important issues. Merry Christmas. I hope you had a happy Hanukkah, happy Kwanzaa, and happy Festivus to the rest of us. All right. Bye,
Merry
everybody.
Christmas, everybody.
Merry Christmas.
Bye.
Christmas.
Merry
Thanks, everyone.
Christmas.
Bye-bye.
Happy
Aloha.
holidays, everyone. Take
Happy
care.
holidays.